Good afternoon. I'm GeekWire co-founder John Cook, and I'm pleased to welcome you to this afternoon's VIP session presented by Regence Blue Shield. Throughout the GeekWire Summit, we've been talking a lot about COVID-19. We started the summit last week with a discussion about the promise of a vaccine, and next Tuesday we'll feature two of the world's leading COVID-19 data experts. And in today's session, we are going to talk more about what the pandemic means for you. Please feel free to submit your questions in the Q&A feature of this Zoom call. Now, I'm pleased to welcome to the summit, Dr. Drew Oliveira, Senior Executive Medical Director for Regence Blue Shield. Dr. Oliveira, thanks for joining us.
Hey, my pleasure, John. It's great to be here.
Yeah, so since we're going to get a bit more personal in this session, I kind of wanted to start by asking you, what has the pandemic meant for you? How has your work at Regence changed? And really, how are you coping personally with this?
Well, I think, like a lot of folks, it's, it has been significant. I think for people that normally came into an office and you are no longer going to the office, that's a very different experience for most folks. From a work standpoint, we have been obviously fairly overwhelmed, if you will, by all the information that's coming in from a clinical standpoint, looking at the medical literature, looking at new data that's coming in, looking at these little short studies that started showing up in March and April, trying to make sense of, what's the right thing for us to do for our members and our providers in our community. And then just the sheer volume of information that was coming in certainly impact a lot of us. We would meet on a daily basis starting in March just to make sure that we were all on track. We were reaching out to every single member that we knew had a positive test, as an example. We then soon found that many of them were doing fairly well, but we did that for at least a couple of months. We also recognized that our provider community was being hit really hard. They were shutting down surgeries or shutting down their offices. Some were really unable to practice, and we pivoted fairly quickly to turn on a number of codes for telehealth. Things that typically had been done sort of on the side, done maybe with a vendor, but not really part of the mainstream provider network. And we really wanted to make sure that members had access to care, and we wanted to make sure our providers could actually deliver that care and still, maintain their livelihood and maintain their reimbursement levels. So I think we're the first insurer in Washington to turn that on, opened it up fairly broadly. We found some pretty interesting things too. We did not anticipate things like telephysical therapy as being a thing. We sort of, initially, like first part of March, we're saying, well, what can be done through telehealth? Very traditional thinking. Then we started thinking, well, you can do video, so you can start seeing things in a video. You can do pictures, and you can send pictures, so you can do teledermatology fairly well. But we hadn't anticipated the ability to do things like telephysical therapy, and we did that because we didn't want people to have to either delay care, but we also wanted to make sure that they would get the care that they needed and get it in a way that was safe for them. We didn't have widespread testing back then. We didn't have enough protective equipment for providers, and they really jumped in and really embraced the telehealth program and experiences, and started figuring out ways that they could schedule appointments, do visits in a way that worked, and then decide if someone really needed to be seen or not.
Yeah, I guess take that telehealth example with physical therapy. What does that look like exactly for the patient and the physician?
Well, physical therapy is sort of an interesting one because you not only think, and compliance is an interesting thing with physical therapy. You go to the physical therapist, they have to touch you. They have to see how your body works. They have to work with you on certain exercises or stretching or maybe even some manipulation. Well, now you're doing it in a virtual way. And you can start doing it actually more frequently than you could where you have to have people come in to the office. So you can actually, ensure that people are actually doing their exercises, and you can watch them do it at home, and you can see if they're doing it correctly. So there's actually some advantages with physical therapy that can be enhanced through technology that you don't see maybe when you do a traditional, you go to the office and the physical therapist said, do these exercises 3 times a day, we'll see you in a week. Well, how often do people do those exercises 3 times a day? Almost, it approaches zero. So we also are seeing some vendors come out with some really interesting technology related to physical therapy. Really, that gaming technology, like the Xbox or the Wii, where it can actually see your body move, and you can actually record body movements for a person doing physical therapy to make sure that they're doing it correctly. It'll tell you that you're doing it correctly. It'll also transmit that information back to your physical therapist, so they know you did the exercises. They know you did it correctly 92% of the time. And then they can identify where you did it incorrectly and actually give you a call and say, let's talk about how you're doing them, and let's make sure you're doing them the right way.
Yeah, well, we got ahead of ourselves there just a little bit because
I
I do
know.
want to talk more about telehealth. But the second part of my question was, how are you personally coping with the stresses of the pandemic?
Well, I think, we all cope in our own ways, but I think it's really important that we actually pay attention to coping. This is not normal times. This is, you are socially isolated. I'm lucky in that I have a home. I've got a space in my home where I can work. I can close the door. I can feel like I'm in an office. But that doesn't negate the fact that you're not interacting with others in a real human way. That human touch, that human, interaction, and you have to find ways to do that. Find ways to connect with your family. Find ways to connect with your coworkers that are really different. And I think that coping mechanism, part of that is learning and identifying those things. The other piece to this whole year that we're all gonna in 5 years hopefully have a laugh about is just the intensity of what's happened in 2020. So the pandemic's one thing. We've got an election is another thing. We've got uh, raising awareness of institutional racism. We've got a lot that's hitting us at once, and all of that's coming at us in a variety of different ways. So part of that coping mechanism is limiting the amount of time that I personally spend scrolling, and they call it doom scrolling now, I think is the term. Well, where
Right.
you get and you just keep going deeper and deeper, and pretty soon, you're pretty depressed in about 10 minutes. So I give myself 5 minutes in the morning. I'll read the New York Times, and then I'm good for a while. I also want to make sure that I'm reading reputable, pieces of information versus social media. So I really limit the amount of time I would spend on a social media site, because you get interesting things coming at you, and sometimes that information is not correct. And I try to filter that stuff out.
Yeah, so maybe some advice. Do not watch the debate tonight.
Yes, I'm not going to.
Not going to. Yes, exactly.
I can read about it in the morning for my 5 minutes, and then I'll be okay.
That's right. Good advice there for all of us. Sticking kind of on the mental health theme, there was a study out this week showing that the depression levels and anxiety levels among Americans is at the highest point since March right now.
Mhm.
So the highest point during the pandemic, and I know it's probably going to get worse as we go into winter. You gave some great strategies there. Are there tools that you see that healthcare systems are rolling out that are going to assist, since this is such an important issue right now? And as we do go into the holidays, people aren't going to be able to spend time with their families, perhaps. Travel is out of the question in many instances. What sort of tools are out there from the healthcare providers that would assist in this realm?
Yeah, mental health has really exploded in terms of what we're seeing in our population, and sort of across the spectrum. Um, as you mentioned, depression, anxiety, increasing in suicide rates in certain populations. all have expanded as a result of just that social isolation. Um, we talked about telehealth before. The behavioral health specialists actually embraced telehealth right away. And so their volume never changed. It actually went up a little bit over time. So they have been able to pivot and do telehealth visits that way. Now,
Yeah, we actually had a mental health expert on our telehealth panel on the Regence Health
perfect.
Tech stage earlier, and she actually was alluding to that. This wasn't as big of a leap for the mental health professionals as it was maybe for the more traditional physicians into
Absolutely.
telehealth. Yeah.
But there's not enough therapists out there. And that's, that is a problem. One of the other things we've noticed with the pandemic is how our health system has deficiencies, and one of them clearly is in mental health professionals. So how do we expand mental health to others? And you sort of ask what kind of tools are available. For all of our members, we made some self-help tools available through a system called My Strength, where you can actually do self-assessments, you can do mindfulness training, you can do stress reduction, you can even do cognitive behavioral therapy that's digitally based. So if you have mild, maybe even moderate stress, anxiety, or depression, you can go through these modules and essentially get sort of a digitally based therapy that can actually, from the literature, actually improves people's well-being. So there's those types of pieces available. There are, certainly the telehealth, is available, through our provider community as well as through some of our vendored solutions. But really, it starts getting into, how do we actually planfully reach out to others and help them? Whereas before we may not be as attuned to others, we need to make sure that we're, asking people those questions. Friends, families, coworkers, because you want to be able to make sure that they're doing okay. And I think you'll hear people say those types of things in conversations. How you doing? And they'll start, a meeting, just want to make sure you're doing okay. I think that's really important to do because we used to talk about the term loneliness, and we used to almost always sort of think about that as the elderly. You're getting more isolated, you're getting older, you're losing loved ones, you may have less mobility. But when we started measuring loneliness since the pandemic hit, it actually hit all age groups, millennials and Gen Xers even more so than the elderly in terms of the increase, and all age groups increased.
Yeah, I think I'm seeing that in my family, certainly, with my father who's living in Ohio, and then my 10-year-old son. And it's certainly an issue as we deal with these issues with anxiety and depression. So I appreciate those thoughts.
Yeah.
We have had a couple audience questions come in, and I would encourage people to continue to ask those in the chat or the Q&A function here. I'll looking at those. In fact, Michael Hirsch has asked about suicide rates and some conflicting data as it relates to suicide rates as it relates to kids in-person school. And he was wondering if you've seen anything related to suicide rates during the pandemic. I personally have not seen any data related to that, but is that something you've looked into?
It's certainly a concern that we have related to, just the rising mental health and mental distress that we have. I haven't seen any data specifically in the in-school population, but there has been an increase in younger adults. It's it's relatively low to begin with, but it's still an increase over the baseline. And so I think it's something we have to continue to look at and watch for, and just be aware.
Yeah, absolutely. And another audience question, bumping back to our telehealth discussion, which I said we were going to get back to. The question is, the pandemic forced a rapid acceptance of telehealth. Post-pandemic, do you believe that telehealth is here to stay?
We certainly hope so. I mean, we've been talking about, telemedicine for decades now. I mean, University of Washington was doing telehealth visits between specialists and primary care docs in rural settings back in the 90s. We had very old setups that we would use to try to connect. And we've been, wishing that we could have more telehealth going forward. The pandemic has really fast forwarded things, a decade. And I think the fact that our provider community adopted so quickly the use of telehealth, the fact that they were able to build it into their workflows like they have today, where you schedule an appointment, a nurse can check you in to your visit, you can do the visit, you can get all the information, you can even send them, the person to go get labs or an X-ray if they need to. That's been a learning process for everyone. University of Washington, my friends in the family medicine department there are anticipating at least 20% of their visits to remain telehealth visits over time. University of Miami, I was talking to an individual there. They expect 30%, and they're trying to even get it to be higher than that. From a practicing physician standpoint, that can actually save you a little bit of time. You're not walking in between rooms. You're not wasting as much time that you might otherwise, and that can allow you more time when you're doing an in-person visit. So you can maybe get that same amount of time to see multiple patients back to back in the morning, spend the afternoon with longer visits for those that actually have to be seen. So I think it can actually improve what we experience from a practicing physician standpoint. I think the other thing that we're going to learn over time as more and more providers start using telehealth is a need to have that interaction be a little bit different. Use of remote monitoring devices, especially for the more vulnerable populations. Yeah, things that you want to sort of see in a visit. I want your blood pressure, I want your weight, maybe some lab tests. How do we get that information back to the provider through a telehealth experience? You have someone who may be sicker. And there do digital stethoscopes as an example that are phenomenal. In my practice with, lots of little kids running around, it was sometimes hard to listen to someone's, heartbeat and heart sounds when, maybe the people in the next room are really noisy. Well, with a digital based one, it's just phenomenal. It's like we sort of learned in med school, and you have these idealized sounds and you went, wow, that's great. And you never heard it again because it was so hard to hear in a noisy environment. So I suspect the use of remote monitoring and remote technology will be changing how we think about telehealth and use of those services.
Yeah, absolutely. And in fact, at the summit last week, when Bill Gates spoke, he mentioned the same idea that we've had 12 years of innovation kind of pushed onto us here in the last 10 months. And I'm wondering, in that regard, what else do you see that maybe has happened in the last 10 months that you think might be taking root beyond telehealth here as we move into 2021 and beyond?
I think from the consumer standpoint, they've also pivoted and adopted telehealth where maybe before they might have been reluctant to use that. And not only pivoted, but the convenience of it is not trivial. And so I'll give you my wife's example. She had an eye infection and doesn't have an ophthalmologist. I said, well, just I don't know, call mine, see if they can see it today. Well, he did it through a telehealth visit and diagnosed it. And she went, this is a lot easier than actually, having to go and drive and get dressed and everything else. I can, I can get care. I can go to the pharmacy. I'm done. So I think the consumer is going to expect that. I think we're also going to see, because we're going to want to, at least for a while, keep people away from others as much as possible, and especially if they're vulnerable, is more things done in the home than we would normally think about. So hospitalizations in the home is something that we've talked about for also years, maybe 12 years, using the Bill Gates analogy. And we will start seeing hospitalizations occur in the home. And that will do a couple things. One, it's easy for a lot of people to be cared for in a home setting. They can bring a nurse in every day. You can bring lab in. You can bring an X-ray. You can bring a bed. You can bring IVs. You can almost get that stuff to your home as fast as you can going to a hospital. And by the time you get checked in and up to a room, you also are in a familiar setting. So you're not in some strange location where you may actually experience some, especially in the elderly, some delirium because you wake up and you got lights and other things like that. So there's going to be some benefit to that. And then from an employer standpoint, hospitalizations in the home will be less expensive. 20, 30, 40% less expensive than it would be going into a hospital setting.
Yeah, what about
So
the cost structure on telehealth? I mean, how does that compare? I mean, you're talking about an in-home care versus in hospital care, but how does that then translate to a fully digital experience?
Well, the vendors for years have had telehealth as sort of a lower cost option, but they've been sort of intermittent or limited in the scope. And I think that's probably why it didn't take off like you would expect. You may have expected it to. Now with your provider, your usual source of care, being able to provide telehealth services and see you if need be, that sort of changes that dynamic. Telehealth itself, even if you pay it the same price, which we will do in the state of Washington, because it's been legislated that way, you're not doing as many things that may be unnecessary. So unnecessary labs, unnecessary x-rays, and things like that don't typically occur like they would in an in-person visit. And we know that from the Washington Health Alliance. They've done a study the last couple of years looking at unnecessary care, stating that about 49%, 50% of the care was either a duplicate or unnecessary care that didn't have to occur. It's not expensive care per se, but it's still 3 or 4% just in that setting. The use of telehealth can actually push data a little bit more broadly across a more interoperative platform, so across your EMRs. So you're actually sharing labs and sharing other data a little bit easier. And you can collect data from patients, either patient surveys, questionnaires, et cetera, that can actually speed up or help you in terms of caring for that member, providing care gap guidance. So is the person getting the right care at the right time, and giving you alerts while you're actually working with that member. I can just see that streamlining, that efficiency really making a big difference in terms of how care gets delivered in the current and not too distant future.
Yeah, well, I could ask a bunch of questions about that. It's sparking a lot for me, but I know we have a lot to get through, and I want to move on, especially into COVID. And I know you started your career as a family doctor here in Washington State. If you were my primary doctor right now, what would you tell my family what we would need to know about preparing to get through this winter with the pandemic and cases increasing right now? What sort of advice would you provide me as a doctor?
Yeah, well, John, certainly for you and your family, we're entering the colder months, and the colder months means that we're inside more, and we are more likely to be in close proximity to others. And so, just like we've been talking about since March, right? 6-foot distance, wear your masks, don't have prolonged contact, with people you don't know that are not in your bubble per se. All those things continue to be really important. Over the summer months, we were outside, we could hike, we could do things a little bit safer. And now as we enter the winter months, we have to be, we almost have to double down on our thinking related to that. Now, some things you can do that you can do right away. So your flu shot, if you haven't had it, go get it and make sure everyone does that. And I think you said you did, and
Yes, I
you made
did.
your kids do it.
It was painless, even though it took my son about 20 minutes to get through the process. That takes 3 seconds.
Yeah, well, it's tough with kids, just to, you almost have to distract them.
But why, from a medical standpoint, why is a flu shot so important? given, you know, it's obviously not a vaccine against COVID. Why are physicians and the medical community pushing that so heavily right now?
Well, certainly, you know, the flu actually can mimic in a lot of ways COVID-19. So any ways you can, you know, sort of limit that, you know, you getting also a condition that could be, you know, potentially very debilitating and or fatal, you want to do that. So we've been pushing flu shots for years and years and years. The other reason is you don't want to get both of those at the same time. And because if you have, you know, a chronic condition, a respiratory condition, and now you have both the flu and COVID-19, that could be, you know, much worse for you. Uh, what we are also seeing, you know, because people have been, you know, physically distancing, is a lot of those respiratory viruses that we would normally see all year long have also dropped down. So we expect to see that continue. I think probably the most important thing for your, you know, your family, I would tell you, is maintain good health, good mental health, good physical health. You know, continue to do things like you normally would. And when things get tough, which they will, because you will feel isolated, I always have people just make sure that they have a plan. And maybe that plan is just, here's what we're going to do today, you know, or here's what we're going to do this week. You know, it's the start of the week, it's Monday, we got school till Friday. On Friday, we're going to do X, Y, and Z. And then we're going to do these things over the, so you can think in short bites just to, so it can be finite and it can be something you can do. And at the end of the day, just say, hey, what did we do that worked? You know, that was fun, that we learned, that we, you know, accomplished. Because if you don't do that, you can really get pretty low in terms of how you're doing. And I think, you know, you know, your family will all have pieces, and having those family conversations, I think, will really help as we get through these sort of the next, you know, 6-9 months before things really start to hopefully turn and get a little bit back to normal.
Yeah, you know, hearing you, Dr. Oliveira, there, it almost makes me think of almost like an earthquake preparation kit that you need for those days when you're getting especially depressed or lonely in these winter months, and it has some things to get out there and do that are fun. We had another audience question that came in just related to kind of putting out your crystal ball of how you see the pandemic unfolding in the next few months. What is your thought process on how this is going to look?
Well, I think it's, I wish I had the crystal ball. There are a number of vaccines in the works. There are 11 in phase 3, meaning that they've passed safety tests. They've passed, that's phase 1. Phase 2, they actually create what you want it to create, such as an antibody. And phase 3 is you give it to widespread groups of people. Some get it, some don't, and then you see, does it work, you know, in the wild, if you will. So there's 11 different vaccines currently in that phase 3. There are, you know, a number of more, scores more in the other process working their way up. When will a vaccine become available? Well, we may see some vaccines as early as, you know, start of the year, you know, January, February. What we won't know is, you know, who they're best used for, how long they last, we'll know a little bit about how effective they are. Are they 50% effective, or are they 90% effective? And then the real question will still be, how long do they last? Do they last for 3 months, 6 months, 2 years? We don't know that. So, you know, we're all in this master course of immunology right now, which is really fun. You know, you're all learning about all these different phases and things like that, you know, trials go through. We're going to continue in that process. But I expect that we will see some vaccines come to us. I think we will see that we will do immunizations to those who are probably the healthcare workers first, frontline workers second, and then it's the vulnerable populations probably third. And vulnerable being either the elderly, those with chronic conditions. But I would also argue that we have to look at the other populations who are adversely affected by COVID-19. And those typically are the lower income populations. Blacks, Hispanics, even Asians have higher rates of COVID-19, including all the morbidities associated with that. Lower income populations also tend to have more chronic conditions that can impact them. So I think as we think about that rollout of the vaccine and who should get it first or next, we really need to think about who also is being impacted the most, and think about those health and equities and health inequities that occur in our system.
Absolutely. And I should make a plug for a session we had here on the Regence Health Tech stage earlier. In fact, the first session we kicked off with in the summit a couple weeks back was our race to a COVID-19 vaccine. So if you've not yet checked that out, all the sessions are on demand through the GeekWire Summit platform. Before we wrap up, we've been asking all of our panelists and speakers at the summit this year kind of just a basic question, trying to shed a more positive light on where we're headed, given a time that we're going through so much turmoil. But what gives you hope right now?
Yeah, I think what I've seen is just that connectivity that people have for each other, and that gives me actually a lot of hope. I think, we saw that, in the 9/11, where people all of a sudden reached out and connected with others. I think we're seeing that now. I just hope it continues, and I expect it to. And I think when we can actually be physically together, I think it's going to be a much richer experience.
Great. Well, Dr. Oliveira, thank you so much. Remember, folks, don't watch the debate. Get your flu shot and create a emergency kit for those lonely days here in the winter. Dr. Oliveira, thank you so much for joining us here at the GeekWire Summit.
My pleasure.